Okay, so you've had a tooth removed. So what do you need to do to reduce the risk of any complications? There is a very small percentage of people that no matter what you do, you may end up with a condition called dry socket. And this is where the blood clot doesn't form properly, leaving the bone to be able to get inflamed and sore. You will know if you get it because you start getting pain that's getting worse rather than better, and it's often accompanied by a really disgusting taste. So if you find that you're getting pain that's getting worse, that it's not relieved by painkillers, then please do get in touch, because there are things that we can do to help with that, and it's usually fairly straightforward. Occasionally you do need antibiotics, but not always. So to help avoid getting dry sockets, avoid rinsing your mouth out for the first 24 to 48 hours, and that means anything. You can eat and drink as is comfortable for you, but avoid that swilling and spitting. You can brush your teeth as is normal at night, but avoid using any mouthwash. And then after 24 hours, if you start rinsing with a hot salty mouthwash, and I generally advise boiling a kettle, pouring some into a cup or a mug with a teaspoon of salt, and let it cool. You want it to be hot but not boiling. You don't want to be burning yourself on that. But rinsing out, ideally after each meal, will help to prevent any debris from getting into the socket where you've had the tooth removed. And again, it'll reduce the risk of infection or other complications. Try and avoid any vigorous exercise or heavy lifting for the first 24 hours. The reason for that is your blood pressure will rise, and again that promotes bleeding from the socket, and we want to avoid or minimise any bleeding, partly because we don't want the area to be bleeding too much, but also because again excess bleeding means that blood clot can't form properly. Really important, avoid smoking and alcohol for 48 hours. Smoking in itself increases the risk of developing a dry socket. Even smoking on the day before you have the tooth removed will increase the risk of you having a dry socket. The reason for that is that smoking constricts the blood supply, reduces the blood supply to the area, so you are more likely to get that inflammation because the blood clot doesn't form correctly. It is quite normal to get a little bit of bleeding from the area, and you can manage this. So you should be given a small gauze pack. All you need to do is to dampen that. You don't want it soaking wet, so wet it, wring out the water, pop it in and press down on it really firmly. I recommend finger pressure rather than biting on it, because you want very firm pressure. You want to leave it in there for about 5 to 10 minutes. Don't keep taking it in and out, because that'll only disturb it and it'll make it more likely to bleed. So put it in there, press down firmly. After 10 minutes, remove it, check. If it's still bleeding, do it again. If you are concerned about any bleeding, phone the dental practice. If it's out of hours, phone 111. Get immediate advice regarding any bleeding, particularly if you are prone to bleeding, although this should have been managed in your appointment. If you're getting any pain, take painkillers as you would for a headache. Now the go-to medication is paracetamol. You want to avoid aspirin because that can promote bleeding, and ibuprofen can to a lesser extent. So although ibuprofen is very good at dealing with inflammation, I would generally suggest trying to avoid that if possible. If you're struggling to control pain with paracetamol, then that may be you do need something stronger. It may be that you had quite a traumatic extraction, in which case it's worth contacting your dentist and seeking advice on that. The other thing, particularly if you've had an upper tooth taken out, is to avoid sneezing, if you can do, blowing your nose, or playing a wind instrument. Now, occasionally a back tooth can create a communication with the sinus. If there's a very, very thin membrane in between the tooth socket and the sinus, you want to maintain that, and things like blowing your nose, sneezing, or the pressure required to play a wind instrument can break that membrane. More often than not, it heals itself, but occasionally a fenestration or a hole remains, in which case you can go on to need surgery. If in doubt, get in touch with your dentist, but I do hope this helps.